in for Health Library. And our first speaker today is Kavya, and she's going to talk on conveying sensitive information to the patient.
We are MBBS student from St. G.S. Medical College. Communicating is an essential skill that every doctor must learn, and some feel inadequately prepared or inexperienced to convey such information, and others feel that conveying such information is distressing and may adversely affect the patient or the relatives or the doctor-patient relationship. And however, usually all the patient really wants to know whether he has a life-threatening illness or not. And although there are cultural variations in how much information and what kind of information to give, breaking bad news in the direct but yet compassionate way is the most ideal way to help the patient and the family cope with the bad news, as well as to accept the reality of the situation and support the patient emotionally, etc. Now, according to this book called How to Break Bad News, a guide for healthcare professionals by Robert Buckman, there are basically 6 steps for as the protocol to break bad news. It says that firstly, you have to get started. Secondly, you have to find out what the patient knows. Thirdly, you have to find out how much the patient wants to know. And these 3 things the doctor has been prepared before actually presenting the bad news to the patient. Fourthly, it consists of actually sharing the information with the patient and the family. And the fifth and sixth point would be to the fifth and sixth point would be to respond to the patient and the family feelings, and how to plan and follow up thereafter. And now this was conveying sensitive information in general. I would like to further elaborate on conveying death in particular, and here is why. I feel that death is inevitable, we all know that, but just accepting this fact doesn't soften the blow either for the patient or the family. And our job as healthcare professionals does not begin and end with just treatment, because in spite of our Herculean efforts, it is very possible to lose patients, and this is something that even the family should understand. And this is why I would like to stress on how, why, and when to convey death in my presentation. So why? There are a number of reasons why you need to convey such sensitive information. One is, it can be for the benefit of the patient as well as for the benefit of the doctor himself. I would like to elaborate on the importance of this issue by giving examples. For example, in a setting like in a government hospital, when a man whose wife is critically ill and he's made to run around to fill up forms and buy drugs and other equipment, and he is kept in the dark regarding the condition of his wife, and in the end the tired, exhausted houseman or registrar comes and tells him that in spite of trying his best, he's lost his wife. And after this also the man does not get time to mourn because he has more paperwork and formalities to complete. This was one example. Another example is a couple gets their child in the middle of the night with high fever or respiratory distress, etc. And it's a busy night in the emergency department, and finally when the registrar gets time to attend to the child, it's too late, or in spite of the best medical help, he is not able to save the child. In such a situation, what can one do? The father, usually it's the father who, more out of disbelief than anger, blames the doctor, and there is usually an argument it results in the doctor getting beaten up, which is increasingly reported nowadays in government hospitals. And this is an example how learning how to communicate death is beneficial to the doctor himself. And another issue, another reason why I would, why this is important is that as medical students, we are groomed to be skilled clinicians and surgeons, etc. But this grooming is not complete till we learn how to communicate effectively with the patient. And right now it is expected of us to know naturally how to deal with such situations or get the knack of it while practicing. But I feel it should be included in the curriculum. And these are just a few of the reasons why I feel that it is important to for us to be mentally and emotionally equipped with this ability. And now, how should this information be conveyed? The most important thing is preparation of the doctor. Like, however junior or experienced the doctor is, he should be well prepared. He should be well versed with this case. He should be able to explain to the family in simple terms what went wrong, what he tried to do, and he should be armed with answers to all possible questions that the family might have. And while doing so, he should be calm and composed, and at the same time not be impersonal. And as regards the methods of conveying such information, there are two basic methods. You can either tell them in person or telephonically. And there are two studies that have been conducted, and basically statistics show that if death has not been anticipated, then the doctors prefer to tell them telephonically that the patient is critically ill, tell them to come to the hospital, and then in person let them know that the patient is no more. Whereas if the death has not been anticipated, then they prefer to tell telephonically that the patient is not going to live. And these approaches to conveying information about a patient's death has coincided with the patient's family's preferences also. And now, regarding the condition updates, it is very important to keep the family updated regarding the situation while the resuscitation efforts are going on, because omission of such information is a frequent complaint. It is important to balance the needs of the patient as well as the family while resuscitating the patient. And because many families have expressed anger and helplessness in such a situation because they just kept waiting in the waiting room and ignored. Now, the responsibility of communicating death is, there's little controversy regarding who should communicate death. It's almost uniformly agreed that the physician who is treating the patient is responsible to convey this information, and it should not be delegated to anyone else unless absolutely necessary. And this is because the physician who is treating him would definitely be well versed with the case, as well as in all probability he would have developed a rapport with the family, so the family would be more comfortable with him. And in case he is not available, you can give it to the on-call doctor. And if you ask when is the right time to convey such information, there is no perfect time to convey such sensitive information. So the little you can do to lessen the shock of the situation is to break it down gently and give them enough time. And to convey how do you convey such information? The family is least bothered in the medical facts, and it's more important to be compassionate. They don't care about the technical details. What is important is to be able to share their grief, to empathize with them, and to give them enough time and space to cope with it. And it is their right to ask as many questions as they want, and it is your responsibility to answer them gently and sensitively. This brings up the issue of how much information to convey. This depends on the discretion of the doctor. There's been controversy. If too little information is provided, there's too much, it's detrimental. also, as far as possible, try to inform the family members of the group, which will be helpful for you, and as well as the family members, they can support each other. Now, I would like to talk about family reaction when they hear the death of a close one. It is varied. It can range from, there are some basic emotions that can range from denial to sorrow, depression, anger, finally acceptance. And this depends on the manner of death. This depends on some cultural values. Like in some cultures, it is considered inappropriate to express too much emotion. These things we cannot control, but what the doctor can control is to let out this information sensitively. So that's, and also so it is our responsibility to adapt to the need of the situation according to how the family reacts. And now after the family has been given enough time to grieve and mourn, now they have to view the body. And now this can be considered as a necessary evil, because it can be painful, but most of the times it's necessary for them to accept reality. It's only when they see the body that they actually realize that he's no more. And especially, so there are certain preparations you should do before you show the body. Obviously, you should make sure they are presentable, so that at least the last memory of that person is a nice memory. And especially this is important with regards to mutilated and disfigured patients. And if there's a death of a child, you should cover them with blankets. You should let the mother hold the child, etc. And to conclude this process, the effective communication doesn't end here. You have to let them ask as many questions as possible. You should also let them know that it is they should be encouraged to consult the doctor if they have any queries in the future. And there are certain things you have to do after the death, like provide written information regarding release of the body to mortuary. If there is an autopsy to be conducted, you have to explain the procedure, especially in medico-legal cases. Tissue and organ donation. Usually, this is a sensitive time to ask them about tissue and organ donation, but they usually don't mind, and studies have shown that they don't mind, and you should just ask them whether the deceased had previously expressed a desire to donate the organs. And the local or tissue and organ harvest organizations should be they should be contacted to determine which approach is feasible. And I just like to mention a special point about death of children, because this is a particularly painful situation. And keeping this in mind, the parents should be given as much time as they want to hold the child. They should be asked whether there are any religious ceremonies or preferences that they have. They should also be counseled as to how to handle the sibling of a child if he has one. And they should be asked if they want to preserve some memento from the child. Sometimes they ask for a lock of hair, etc. Now, after death, there is some controversy regarding using the body of a newly dead for the purpose of medical research and advancement. Now, this has many problems with regards to written consent and disclosure, etc. Apart from the fact that approaching a grieving family to ask them to donate their relative's body is a very difficult situation. And right now, there are no universal laws or policies regarding this, and every institution differs in their policy. I would like to conclude by saying that as a medical student, why is this issue important to us? Because I have highlighted the importance of tact and experience in conveying such information. Now, this tact and experience will only come when we have been adequately and appropriately trained in such communication, and then and as one component of such training, the medical student should be allowed to accompany the doctor while conveying such information, and after this he should be encouraged to have an open discussion regarding their experience. But by no means should he be told to convey such information directly to the family. It is not the responsibility of the student. It's a very sensitive situation, and only the attending doctor should handle it. The houseman, on the other hand, should actively participate in communicating such information as part of his clinical training, and under guidance, of course, initially. And then I would like to conclude by saying that the emotional needs of the family and the integrity of the doctor-patient relationship should be held foremost in considering all facts. And one may be a renowned doctor, a renowned surgeon, highly skilled in his or her chosen field, and yet lose a patient once in a while. This does not take away from one's credibility. In fact, the mark of one's greatness is being able to handle such a situation with maturity, to the ability to empathize with the family and be sensitive to their needs after such a loss. Because after all, we do not have just a responsibility to the patient, we also have a responsibility to the family. Thank you.